My first professional close relationship with Keith and with Shabir was when they were in South Africa at WITS. We had developed a pneumococcal conjugate vaccine. We really wanted to see how this vaccine would work in a population like in South Africa. And the study that was done by them, one of the largest studies done with this vaccine, was enormously successful.
I really entered into the field really not knowing what it entailed to be a clinician scientist and what it entailed to be a researcher.
He and I were, along with many others of that generation, were at the front lines of fighting apartheid. Our roots as activists, I think, is what fuels us as professionals today.
I was born in South Africa at a time when there was enormous inequity in South Africa, and I think that influenced my future career.
Our parents were also, both of them, very ethical people who modeled to us the practice of service to others. And you can see this in the choices Keith has made throughout his career to try to do work that would make a difference to people across the world.
I was the director of the South African Institute for Medical Research, which I needed to recruit someone to head up the clinical aspects of the trial. And I was delighted to be able to appoint Shabir Madhi to that position.
And it's really under Keith's mentoring that I really got to understand some of the nuances of what it meant to be a researcher. And what happened subsequently is really one of me realizing that as a healthcare practitioner, there was much more than just being a practitioner and providing care. There were other opportunities which medicine actually presented, where you are able to basically contribute in a way which goes beyond just being able to deal with an individual at an individual level.
He and Keith really did the seminal trial on pneumococcal vaccination, showing that it was highly effective in our setting in South Africa, and that it had added benefits beyond just protection of pneumococcal disease. With Keith's support and mentorship, the two together really have done some of the most outstanding work globally.
It is extraordinarily gratifying to have someone of the caliber of Shabir to not only run a successful research unit, but he expanded it greatly and has done incredible work over the past decade to evaluate a number of vaccines that can save lives of young children globally. Before we did our work on pneumococcal conjugate vaccine, close to 1 million children were thought to die every year of pneumococcal disease. The introduction of these vaccines has saved millions of lives over the past 1.5 decades.
There needs to be a greater recognition that what vaccines are all about is not just about making profit. What vaccines are about, and have always been about, is about saving lives and reducing suffering. We need to re-engage as a scientific community, and we need to come together and realize that we are one in this small planet that we inhabit. And it is in all of our interests for there to be greater equity when deploying vaccines.
I believe strongly that the secret to a successful career is to be passionate about what you do. So I have given hundreds of lectures around the world, and I hope that my enthusiasm for saving lives, my enthusiasm for these extraordinary vaccines can be transmitted to the audience. And it's that enthusiasm that means I do this with joy.
For people working in our field, I think the Sabin Gold Medal is the top award one can receive. It's an amazing feeling to get up there in front of your colleagues and to be honored.